Hi, I'm Congressman Patrick Kennedy, and I'd like to thank all of you for being here this weekend to attend the Association of Community Mental Health Centers of Kansas annual conference. I'd like to also ask all of you to pay tribute to Jim Ramstad, as this is his final year in Congress. As many of you may know, he recently announced his retirement. He's been my partner in Congress on a bipartisan basis. Both of us have been championing the mental health parity bill, and as he leaves Congress, it's even more important that we redouble our efforts in the effort to pass parity. It's my hope that this year we will pass mental health parity as a tribute to Jim Ramstad. He certainly deserves it as a memorial for his tireless efforts over the last 18 years as a member of Congress. We have two parity bills, one in the House, one in the Senate. The parity bill that Jim Ramstad and myself have in the House requires that the same benefits that members of Congress have should be the benefits that all Americans enjoy in terms of mental health benefits and parity, and that is that the DSM-IV applies with insurance, that mental health is defined based upon a clinician's definition, not based upon an insurance policy's definition. Unfortunately, the Senate's bill is defined based upon what's negotiated between the insurer and the employer. And of course, as we know, that means that such benefits like substance abuse and eating disorders and things like that, which are less popular, may be left out of coverage when negotiated between the employer and the insurer, and therefore may not make it in the plan. That is the essential difference. The positive news in the Senate bill, however, is that it does not preempt the states, and we did manage to succeed in overturning the Senate's initial language that preempted states, which means that now states can mandate that parity include substance abuse and also eating disorders or whatever they may want, and therefore can go further than the federal government. Therefore, the federal government can act as the floor and not the ceiling, so to speak, as far as coverage is concerned. And that is a big step forward. So we have a long ways to go. If we do pass the Senate bill, we still have to go further. It's my hope that we do pass the House bill. For those of you who are listening to this now, it's time for us to redouble our efforts to pass the Kennedy-Ramstad bill. And I ask all of you to call your members of Congress, your United States senators, and to talk to everyone you can to see that that bill gets passed. We also have other legislative initiatives up every year on the floor that need your support. We were able to increase the amount of money for drug courts this last year to $40 million. But as you all can imagine, $40 million doesn't go very far on a national basis. When you consider that we have 2.25 million people in our prisons every year, it's really a drop in the bucket when mostly 67% of them are there because of drugs and alcohol, and yet we could reduce recidivism rates, which are over 70% on a statewide basis for state prisons, by upwards of 35% if we had drug courts. Former drug czar McCaffrey said it's the most effective weapon in the war on drugs that he's ever seen are drug courts, and yet we really give them short change in terms of funding. So I'd ask you all again to lobby for more funding for drug courts. This is a very important initiative both on the federal level and also on the local level. And this also includes mental health courts, which is also very, very important. And in Congress now, we're also working very much on the Leave No Child Behind Act. We're working on this to codify Foundations for Learning, which is early childhood education, but we are focusing on parents. We know that if a child comes from a home with a mother or father that's depressed, is involved in drug or alcoholism, with mental illness, or is incarcerated, or in deep poverty, that child is obviously exponentially higher risk for ending up in trouble themselves. So we need to focus on helping to ameliorate the needs of the parents in order to reach the child's needs. We know this from all developmental experts in child development, that in order to reach the child, we need to reach the parents. This is part of our focus on the Leave No Child Behind bill, and it's a section called Foundations for Learning. And I'd ask all of you to pay attention if you're interested in that on the Leave No Child Behind Act. There are other issues as well. In addition to that, we have the Juvenile Justice Reauthorization Act. This is an attempt for us to tie in our juvenile justice system with our education system and the private sector and the public sector. There's really no communication so much as there should be out there, and we're trying to make sure that there is more interoperability and communication amongst all of those agencies. And we need your input as far as that's concerned. The community mental health centers are going to be integral in all of these answers. Obviously, we also need to pass the effort to ensure that child relinquishment doesn't continue. In many parts of the country, children are basically relinquished to the state because parents can't get mental health coverage for their kids and have to turn their kids over to the criminal justice system or the foster care system because there's no other alternative for them to get the mental health needs for their children other than to turn them over to the custody of the state. That is really immoral and shouldn't be allowed in this great country of ours. We need to do better than that, and we need to pass the child relinquishment bill in Congress that I'm working on, among others. So there's a tall order in Congress in addition to increased funding for the National Institutes for Mental Health, National Institutes for Drug Addiction, and National Institutes for Alcoholism, in addition to more funding for SAMHSA, and all of the funding for our community mental health centers and the like. There's a big agenda. All I would ask you to do is we need to get our consumers to be more proactive and more politically active. I am someone who suffers from bipolar disorder, and I'm an addict and recovering alcoholic and recovering addict. I believe that even though I belong to an anonymous group, that it doesn't mean that I hang up my citizen responsibilities at the door. Bill W. testified in front of Congress. I would encourage everybody to get the word out that we'll never reach the day when we end discrimination if people remain silent in this country. It's about time that we get people out there to say enough is enough. We're not going to tolerate this discrimination of diseases. If this were cancer and people were being denied treatment like they are being denied treatment for their mental illnesses, people would be hung in effigy up here and be thrown out of office. And the only difference is it's a disease of the brain, and that's the only difference, and yet it's being permitted to happen every day, and as a result 150,000 Americans are dying as a direct result every year. It's unconscionable, and it has to change. And so we need to get the political change necessary to make it happen, and that's only going to happen if people speak up. So I encourage all of you to get politically active so that we can make the political change necessary to get all of these bills passed and to change the environment so that people don't have to die anymore of these illnesses. Thank you for the great conference that you're part of. Let's keep going and move forward, and someday we'll be able to get civil rights for all Americans who have these illnesses through no fault of their own, but for the fact that they were just born with these illnesses, and they will need to be treated as equal as everyone else is treated. And thank you again for the good work that you do. My Uncle Bobby said that each time a person stands up or acts to improve the lot of others, they send forth a tiny ripple of hope. And coming from a million different centers of energy and daring, those ripples can create a wave that can knock down the mightiest walls of oppression and resistance. we can create those ripples, and those ripples coming from a million different centers of energy and daring can create this wave that can knock down this discrimination against those with mental illness. And I'm hoping that you'll create some ripples out there in Kansas and help us knock down this this discrimination. Thank you very much, and good luck with your annual conference.